Hello and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today we're going to talk about kitty arthritis. And I have talked about Solensia and other products for arthritis in cats before, but I really wanted to focus on this undeserved pain and suffering that cats receive when they have osteoarthritis, because it is not recognized even from some vets and some mostly all pet owners that I come across. They have a difficulty identifying pain in cats because they're expecting them to grimace or just express it, vocalizing, or trying to jump and not make it. And those are easy ways of detecting pain, right? But the cats are smarter than that. They usually avoid any problems. If they know they cannot jump into something, then they're going to avoid doing that. And you're not going to see those difficulties. They try to look cool all the time. When have you seen a cat that is not cool, right? So they try to pretend that everything is okay. And so when you see the behavioral changes, it could be a little increase in aggression. You know, they're a little testy, especially inter-cat aggression. They get a little bit in trouble with their companions that are younger, especially. And you could see them not wanting to eat. That could be a pain sign, especially if there's oral pain, because again, the teeth are very sensitive, and they could have resorptive lesions and things like could cause pain. But I want to focus on the pain caused by the osteoarthritis, and the reason is I've had several cases this past week, and as often happens that I get the inspiration for the podcast and something that I've seen that week. And this week we've seen a lot with kitties. And I kind of like argue with some owners as like, your cat is in extreme pain and I have to demonstrate the pain for the owners. And how do you demonstrate the pain is basically range of motion restrictions. So in a study, there's a couple of studies that I have read about cat arthritis. And in one study, over 90% of all cats aged 12 and older have signs of arthritis in one or more joints, multiple joints. And these are radiographic evidence of arthritis. And we know that some arthritic pain takes some time for all the bony changes to show in the x-ray. So that means that these are chronic pain sufferers in these kitties. So a lot of the veterinarians that are listening to me probably are integrated practitioners, and we're more aware of the pain, and we do a lot more orthopedic exams. Any chiropractor out there or any pet spinal manipulator out there, they will do a really good orthopedic exam, a motion palpation exam, and they will really find the source of the pain. But all the acupuncturists that are listening to me, this is very important that you cannot miss the orthopedic exam, because where the restriction is telling you that the flow of chi is blocked, and that set of meridians that cross that joint, those are the ones that you have to clear. You could use a distal point for it. You could use a level 3 shoestring pain relief point. But for acupuncturists that are listening, these are the things that we need to, consider. And we can see that there are very few alternatives for cats as compared to dogs for the management of arthritis. And that's why it's important for us to recognize that if 90% of cats 12 and older have some evidence of osteoarthritis, we are under treating or under appreciating the magnitude of this problem. And so one of the things that I wanted to for the ones that are listening that are owners, changes in gait, whether it's avoiding jumping. All of a sudden they used to sleep in the sofa or sleep high in the refrigerator, and they stop doing that. That's one change in jumping or achieving higher heights in the house, or using the stairs. They stop going on the second floor because they don't want to use the stairs. they just don't groom. So sometimes they stop grooming, especially in the hip area, and you see all these mats that are that never happened before. A lot of dander accumulation. That means that the pet is not cleaning themselves, especially around the hip area. And objection to being handled or picked up because your the spine is not as flexible as it was before. And so any kind of posture behavior, plantigrade stance, which means the hocks or the ankles are almost parallel with the floor, that's really not a good idea. That's really good evidence that they have pain, because they would never stand with the plantigrade stance. And so, again, you're not going to see a lot of like pain as you would see in a dog, where if you touch the joint, they will, scream or anything like that. There are tools for the listeners that they can use. So it is petcare.com has a checklist. If you look in there, put the search for osteoarthritis checklist cat, it will show you a list of things to look for. I like the feline grimace scale. Is felinegrimacescale.com is a really cool tool. It's just how the facial expressions of cats can tell us the degree of pain that they're going through. But nothing is more important than a good orthopedic exam. And when I say an orthopedic exam, you're going to put all of those joints into motion, carpus, elbows, shoulders, inflection and extension, and you're going to palpate and see how the joint feel. And I even would go, I know that a lot of people are not rehab practitioners, but a goniometer, you can get it in Amazon.com, and you can just get a goniometer, which is a way to measure the angles of extension and flexion of the joints. And you can do that. You could measure also the muscle mass of each leg, and these will be in hopes of getting some sort of objective measurement that we can tell that things that we're doing are helping. Obviously, I'm going to recommend to do radiograph, even if they come for integrated medicine. Radiographs are often a really good way to diagnose, to localize the pain after or confirm what you found in the orthopedic exam, but also to rule out cancer, because unfortunately degenerative joint disease and bone cancer could happen, and you need to know. Cats that are at risk, obviously, are the obese cats, the cats that have been declawed because they're shifting weight and they have abnormal patterns of gait. And so these pets that are older than 12, 90% of them are going to have arthritis. So these are the things that you're looking for: the obese, the older cats, and the ones that have been declawed. And you're going to definitely offer them something. I don't like non-steroidal anti-inflammatories because although meloxicam is used for pain, we have side effects. And one of the side effects could be gastric ulceration, gastric ulcers, but also kidney disease. So we have to be very careful, especially if the cat already has some signs of kidney disease. And we know that cats over 12 do have, a vast majority have early signs of kidney disease. And so we have to be very careful. Even Onsior, the only non-steroidal anti-inflammatory that is approved for cats, even that one is only approved for post-op care. And even in Europe, where it's used widely for arthritis, they have in the label that if after 6 weeks you don't see an great increase in function, then to discontinue it. Why? Because the side effects are going to be worse than the benefits. So those are the things that we think. And I know gabapentin is used widely, and I have a couple of friends that will assassinate me, the integrative practitioners, because they know that there's not a lot of studies out there, very few studies that can prove that gabapentin helps with pain in dogs or cats, but we assume that it does because of the feedback of the owners. The pets seem more comfortable. I believe that it's probably the same effect as tramadol, where they just have a little bit more sedative effects, and maybe that's why it works in some cats. But definitely it's a great product to use to calm them down. I think that it works on their mind. If the behavioral changes are the main change that you see with arthritis, it kind of like makes sense that gabapentin exerting influence in the behavior, then it would be a good tool to use. I probably would use it just the way as I use even omega fatty acids, which are natural way to control inflammation in the cats. Another adjunctive things that I would do would be acupuncture, obviously, and as I mentioned, Shoestream. That's a great way to treat them. A laser is great, and a CC loop in cats is awesome. They are sleeping, you put the CC loop, and it really helps them. I've noticed a great improvement. I have, the Millers is one of my favorite clients, and they have their pets, and they have a lot of elderly cats, and they multiple of their babies have arthritis, and they purchase their own CC loop all the time, and they keep control. One of them or two of them are a little overweight, and that is why they have the worst hips. But in addition to trying to control with the diet, which is really hard because the cats are just so hard to get diets, there's not that many options, The monoclonal antibody treatment with Solensia that Zoetis took to the market, I think that has been working magnificent in pets that truly have arthritis. And so that is not a non-steroidal, that doesn't have any really side effects. It is a little expensive, especially because it's out in the market now, but I think it's definitely worth it because you don't have to pill the cat, you don't have to do anything. And what I have seen is after the third injection, we can have amazing results from the first one. But after the third one, I see the change, the pain signal is modified. So the pain is not as acute. I think that we retrain the brain to the pain pathways to get the signal to the brain, and it modulates it. But it might not need to be done as frequent as once a month after the third injection, depending case by case, obviously. But there are alternatives out there. What I don't want us to do is to put this problem under the rug and, it's an old cat, it's going to have arthritis anyways. They do have pain. They will immediately change their behavior, be more active, be more interactive with you, and just have a happier, more productive life if we control the pain. So I want us to make sure that we are paying attention to kitty cats and their arthritis, especially if they're over 12, 90% are going to have problems. So might as well, if you're a pet owner, take it to your vet, discuss arthritis. And if you're a veterinarian, please do not forget the kitties that are in their golden years. Let's make their golden years truly shine by controlling the pain. Thank you, and I hope you learned something today. Hit the notification, the bell, so that you can be aware of the new episodes that we're posting every week. Thank you.